This video will discuss chronic diseases, which are long-lasting or recurrent conditions. A chronic disease is defined as a long-lasting or recurrent medical condition. Chronicity is typically applied to conditions that persist for more than 3 months. We will examine 3 types of diabetes, starting with type 1. This form is often diagnosed in children and young adults and involves the body not producing insulin. With proper treatment, those with type 1 diabetes can live long and healthy lives. While type 1 and type 2 diabetes have different causes, both require inheriting a genetic predisposition and an environmental trigger. Identical twin studies show that genes alone are not sufficient to guarantee the disease develops. Type 2 diabetes has a stronger genetic basis, but is heavily influenced by environmental factors, especially a Western lifestyle. Risk factors include poor diet, lack of exercise, and obesity. High-risk ethnic groups in the U.S. include African Americans, Mexican Americans, and Pima Indians. Type 2 diabetes often runs in families due to both learned habits and genetic factors. The risk to a child varies depending on the parent's age at diagnosis and is about 1 in 2 if both parents have type 2 diabetes. Glucose is an essential fuel for the body, and its level in the bloodstream is primarily regulated by the hormone insulin. This image provides an overview of diabetes. Here we see a visual representation related to diabetes in Boston. Additional information on diabetes. More details regarding diabetes. Further points about diabetes. A continuation of the topic of diabetes. We are continuing with information about diabetes. More information related to diabetes is presented here. Cholesterol is a waxy substance necessary for cell function, hormone formation, and vitamin D. It is transported by lipoproteins, the most important being low-density lipoprotein, or LDL, and high-density lipoprotein, or HDL. HDL is considered good cholesterol because it helps prevent bad LDL cholesterol from clogging arteries. Low HDL levels increase the risk of heart disease. LDL is bad cholesterol, and too much of it can clog arteries, increasing the risk of heart attack and stroke. This slide visually depicts the process of high cholesterol leading to blocked blood vessels. Lifestyle modifications like a heart-healthy diet, regular physical activity, and avoiding tobacco smoke are key to managing cholesterol. Public screenings can also raise awareness and detect high cholesterol levels. It is a myth that using margarine instead of butter will always lower cholesterol, as both are high in fat. Limiting saturated and trans fats is key. Also, thin people can still have high cholesterol and should have their levels checked regularly. This slide lists various symptoms. Next, we will cover hypertension, also known as high blood pressure. Further information regarding hypertension is presented here. High blood pressure is diagnosed by monitoring blood pressure over time. Normal blood pressure for adults should be less than 120/80ths of a millimeter Hg. About 1 in 3 U.S. adults has high blood pressure. The systolic, or top number, is typically given more attention for those over 50, as it is a major risk factor for cardiovascular disease. Systolic pressure often rises with age due to arterial stiffness and plaque buildup. Continuing the discussion on hypertension. More details regarding hypertension. Final points about hypertension.